Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Shiv Goel. He's an internal medicine and functional medicine physician. Today's Kevin MD article is Mind-Body Connection in Chronic Disease, Why Traditional Medicine Falls Short. Shiv, Happy New Year. Welcome to the show.
Happy New Year, Kevin. Thank you for having me here.
All right. So we'll talk about your article in a little bit, but first off, just briefly share your story and journey.
My name is Dr. Goel, and as you say, I'm specialized in internal medicine, functional medicine, aesthetic, and cosmetic. But as far as my journey is concerned, I grew up in India, a family of 9 and with limited resources. I think that shaped everything. My resilience, my drive, and my deep empathy for people who feel unseen by the system. And I trained in anesthesia and critical care in India before I moved to America, where I trained in internal medicine at Mount Sinai School of Medicine in New York. I spent years as a hospitalist. Then I became a medical director at Methodist Hospital in San Antonio. I taught as an assistant professor at Texas Tech. But there's something which kept nagging me. Like in the ICU, I saved lives in the moments of crisis. But in the clinic, I watched patients return again and again with the same chronic issues: diabetes, high blood pressure, obesity, fatigue. And despite doing everything right, and the medication, it looked good, the numbers look good on the papers, but I felt that people weren't healing, or I would say that changing, or they're feeling that they are alive. And that frustration led me to functional medicine and evaluating to founding the Prime Vitality where I work, where I could practice differently. And that's why I left that, I would say, bureaucratic system. And I wanted to ask not just what disease do you have, but why do you have this disease? What is the root problem? What's really going on beneath the surface? And that shift changed everything for my patients and for me.
You talk more about that in your Kevin MD article, Mind-Body Connection in Chronic Disease, Why Traditional Medicine Falls Short. For those who didn't get a chance to read your article, tell us a little bit more about what mind-body connection is and the article itself.
So this article was born from a real patient encounter, Linda, and she had seen 7 physicians. And I think her story is not just her story. Her story, it mimics story of so many patients of mine. And she was on multiple medications. She was doing everything right: the diet, the pills, the exercise, and nothing was working. And one day she looked at me and she asked, why isn't anything working? And that question kind of a bit of haunted me, because on paper, everything looked perfect. Her numbers being managed fine. But she feels exhausted all the time, not just physically, but existentially. And as I listened deeper, as I spoke to her more and more, I realized her disease wasn't the problem. It was her symptoms. And when I came to know more about her, it seems like she had this decades of suppressed grief, this childhood emotional neglect, feeling invisible even in her own marriage. And this constant lack of fear of failure, and whether it is at work, whether it's in her relationship, the more she tried to give, she was burning herself from every end. And as I started, researching more about it, about the psychoneuroimmunology concept, where the science connecting psychological states to your physiological functions, the thoughts trigger neurochemical cascades. Emotions modulate the immune response. Belief can alter gene expression through epigenetics. So all of it is actually linked together, because it all begins how we perceive ourselves. And if we are in the perception that we lack something, we have to keep proving something, we have to keep doing something, whether it is to get a validation from the society, from a relationship, or from the work, we keep burning ourselves and we will never be up to. And that's why I think a lot of my clients, I have noticed, a lot of the patients which I have seen, they were not feeling that they are living, as if they are just existing. So when we address that, whether it is through the somatic therapy, whether it's through meditation, or examining the inherited belief, because it is not just their problem, it is a generational problem which start from their family before them. And her blood pressure after about 3 months, when I started on a program of, I have a program in which a breath work, some mindfulness, some stress reduction techniques, her blood pressure normalized without medications. And her hemoglobin A1C dropped, and she lost 30 pounds. And not by depriving herself from food, but through transforming her relationship with herself.
Mm-hmm.
And I wrote this article because I believe we are missing something profound in medicine. And we are treating downstream effects while ignoring the upstream causes. And any patients like Linda, and there are so many patients, they are paying the price. And not just the patients I have seen, even the physicians, because we cannot heal, we cannot really truly treat patients when we haven't healed ourselves. How many patients, how many people really think about that? Because they themselves are burning from the both ends. They don't have time in order to make their living in the time when the insurance company and everything is like giving you the hardest time. You end up seeing 30 patients, 40 patients a day. You start your day in the morning. You don't even have a time to think, have you had a breakfast or not? And by the time you come home, it's night. So how we gonna make any change? And when it comes to the patients, hardly patients say that my doctor doesn't even have time for me. A nurse practitioner sees me for 5 minutes. So where the change gonna come from? And that's why I decided to write this article.
So in that case that you told us about Linda, you bring up the concept of psychoneuroimmunology and how processing sometimes unprocessed emotions or
Grief,
suppressed grief and trauma can affect patients physiologically. And in Linda's case, it improved her blood pressure, A1C, and other labs. What other manifestations, physiologic manifestations, could be improved by processing these unprocessed emotions and trauma and grief? What other examples of physiological improvements can you tell us?
I think there are so many of them. If you see that the stress response, our adrenal gland, which is our more a endocrine organ, which modulates the stress. Okay, so when we address the stress or those psychosomatic immunological issues, which is causing, it's like a vicious cycle, and I'll explain it to you in just a couple of minutes. So what happens, our adrenal gland, as it's made up for to mount a stress and like a fear and fight response. In the morning when we wake up, it's like, oh, let's go. Like it used to be like hunting and everything. Let's go. It's the start of the day. Okay. When we have a chronic stress happening or there unresolved grief or a pattern which is under the surface, our adrenal gland remains in that elevated state. So what happens, it started to push pregnenolone, which is the main hormone from which everything starts, whether it's going into the cortisol directions, adrenal, or going to the sex hormone direction. So the axis shift towards that. Okay. As a result, you have low progesterone, estrogen, and all other hormones, and you have more of corticosteroids in the body, like you can name it, adrenaline, noradrenaline, and which causes your body to remain in an elevated state. Now, over a period of a chronic stress, that adrenal gland goes into fatigue completely. So you stop mounting that response when you wake up in the morning. So as a result, you feel fatigue. You feel like that you haven't had a rest. You feel like you have a bone deep exhaustion, a soul deep exhaustion. Because no matter how much you can rest, no matter how much you improve your diet, okay, it leads to your blood pressure gonna remains up. You're gonna have a pulmonary hypertension. You're gonna have anxiety, depression, because our hormones also do the neuromodulations and affect our neurotransmitters as well, which results in further That's why we see a lot of rages on the road. That's why we see people are having a lot of anxiety issue, panic disorders, even a lot of what we call idiopathic disorders, such as restless leg syndrome, irritable bowel syndrome, and whatnot. Everything is connected. It's just a cascade of things which started to happen.
Mm-hmm.
They're going to have an increased insulin resistance. So more propensity to have diabetes mellitus, increase weight gain, decrease immunity, especially the GI immunities, because your IgA level goes down. So everything begins at the level of mind, thought. And we do not even have time to quiet our mind, to listen to our body, because our body realizes it before the mind does.
So what do you do in your exam room to process some of these emotions, trauma, and grief? Do you have training from a behavioral health standpoint? Do you refer patients out? What kind of approach do you use, especially if there's a strong mind-body connection?
I think in my experience, one needs to hear. I just create a space. I create a space for them to feel safe. I create a space for them to be heard. And that, I don't think, see, if the people gonna need a evaluation from a psychiatrist, yes, we do refer them for when it reaches to that. But a lot of time, because amount to the fact why the amount of psychiatric disorders are increasing and increasing. What do? Psychiatrists just prescribe medications, which is not a solution. It is a stress at a massive, it's an epidemic which has crossed over. So just by referring the people from to here to there without even listening to them. So my first and most important thing which I do is I create a space. I let them say, I hear to them. And I think a lot of time, almost 80% of the time, I know what's going on. They do not even have anyone to hear them out. And I know, being a functional medicine physician, which is another thing, I wanted to talk about, but we don't have much time, is that how can we streamline this process in which we don't have to spend hours and hours with the patient by integrating some of the techniques so we can navigate this process faster. Because we are in 2026 today. We just passed over 2025. And 2025 was the year in which people have started to awaken. Mm-hmm. They started to realize. And this is my message to all the fellow physicians too, that heal first. And life is not here just to exist, born, be a physician and die. If we are here to make a difference, we have to start making a difference from within. We can't heal anybody for real unless we heal ourselves. And that is why I think what Linda said, that's what I felt in my life. That's what I see so many of my colleagues feel, that they have everything. They have money, they have good, everything, but they still feel exhausted. They still do not feel that contentment, that happiness, because of the same thing. We keep chasing things outside. We don't even have time to just sit down and listen to our body. And the trauma doesn't store, the definition of trauma itself is not that has to have an external factor to create the trauma. We are creating trauma ourselves so many times without realizing it. And unless we know, unless we heal, and unless we understand the psychoneuroimmunology of every thought process, how we perceive things, how the biology of it reflects our inner world, we cannot truly bring healing in the world.
As you said, you're working to streamline the process. I'm a primary care physician, and as you know, a lot of primary care physicians are under a lot of pressure to see more patients in limited amount of time. Do you have any specific questions or techniques that we can even approach this issue in a traditional medical setting where we only have 15 to 20 minutes with a patient?
Well, in the traditional medicine, that's why I switched to the functional medicine. Traditional medicine, really, you cannot do much in 15 minutes, okay? But you can do a lot, like what a functional medicine achieve in 45 minutes, you can definitely achieve in 15, 20 minutes, as long as you know how to navigate it. First, the intersection of this consciousness and healing. Second, the epigenetics. And third, the AI in functional medicine. We are in 2026, and I'm building this timevitality.ai, which help people to see the pattern in their story and the connection between the sleep, stress, hormones, gut health, and their lifestyle that reveal the root cause of their issues. So not to replace the physician, but to extend our capacity to truly understand each patient and reach those who can't extend this kind of care. So by integrating, by bringing a work system, a flow system through the AI, you can bypass, you don't have to, you can send that, like patients just go online or through their email, they can get a link and they just, it's like a questionnaire and they enjoy, a lot of them, they enjoy because it's more kind of a, initially start with a multiple choice and then it's an open-ended, they can write it anything over there. And by the time it creates a synthesized report of that, and then it comes to you, you can evaluate before the patient appointment. That saved 30 to 40 minutes. And you know what exactly is going on. And a lot of time, patients feel comfortable doing that at home because sometimes they feel being judged or intimidated in front of a physician. So I think this is something which more and more people should adopt. And the second thing is, I said epigenetics, basically how trauma can be inherited, and more importantly, how it can be released, like how we can undo that process which has happened. So there's a lot of research which is happening on that, but at the end, the treatment, the modalities are up to the patients. So we develop few techniques such as box breathing and mindfulness techniques, and each person has a different take on it because we cannot say give the same formula to everybody because they have different issues. They are at different level, different stages of their stress, of their trauma. So that's how we do it here.
We're talking to Shiv Goel. He's an internal medicine and functional medicine physician. Today's Kevin MD article is Mind-Body Connection in Chronic Disease, Why Traditional Medicine Falls Short. Shiv, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yes. I think my take-home message is this, that it's not just for patient, it's for every physician listening. Yes, the body doesn't lie. It faithfully reflects when the mind and the spirits have been carrying, sometimes for decades. That's true for our patients as well. But here's the harder truth. It's also true for us. Before we try to heal anyone else, we have to heal ourselves first. Because if the healer hasn't healed, how we are going to bring real change? What Linda taught me wasn't just about her. It was about me. The disconnect between the mind, body, and spirit. That was somewhere inside me too. The burnout, the exhaustion, the sense that I was going through the motions but missing something essential. I had to face that in myself before I could truly hold space for someone else. So through Kevin's podcast, I want to invite every physician listening to be more open. We all have a responsibility to ourselves first. Even healers need healing. And we cannot guide patients towards wholeness if we haven't begun that journey ourselves. The beautiful paradox is this: a lot of time we heal ourselves while healing others. While a lot of times, while I'm healing my patients, I'm actually healing a part of me. Every patient who trusts us with their story gives us a mirror. Every moment of true presence is an opportunity for our own transformation. Thank you.
Shiv, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin. Thanks for having me here.